Hello, my name is Diane Glenn. I am a family nurse practitioner student at the University of the Cumberlands, and I am going to talk to you this evening about the risk of lead exposure in children and how the school system, the health department, specifically environmental health, and primary care providers can help protect our children in our communities, and what resources we can use to address any exposure issues in children at risk. Prevention of lead poisoning is a public health responsibility. Population-based screening programs can be implemented and the prevalence of lead toxicity in children can be discovered. Primary care providers also play a critical role in the process of preventing lead toxicity in children. Obtaining lead exposure histories is important. Key things parents should know. Lead can enter the body through the mouth and also, however rarely, through the skin. The most common way for a young child is through the common hand-to-mouth activities, while eating, at bedtime, or while mouthing on toys or objects. Lead affects just about every system of the body, especially the developing brain and the nervous system of unborn babies and children 6 years of age and under. Shortly after the lead enters the body, it travels in the blood to the soft tissues, liver, kidneys, lungs, brain, spleen, muscles, and heart. After several weeks, if lead is not eliminated, the body will begin to store the lead in bones and teeth. The body confuses the lead with calcium and will store the lead in empty calcium storage sites. About 99% of the lead taken into the body of an adult will leave in the waste, in urine, feces, hair, nail growth, and sweat. However, unfortunately, only 32% will be eliminated from a child's body. There's no safe level of lead in children. Exposure to lead is linked with many conditions, especially those related to the neurologic system, including lower IQs, attention deficit hyperactivity disorders, reading problems, school failure, and delinquent criminal behaviors. Lead easily crosses the placenta as well, and prenatal exposure may be associated with schizophrenia and autism in later childhood. GI issues, renal, musculoskeletal, reproductive, thyroid, and cardiovascular diseases can also occur. The effects can be permanent, and especially in children. And boys may be more susceptible than girls to the effects prenatally. Children who have numbers scoring at greater than 5 deciliters may have learning disabilities. Children who score at levels of 40 have less ability to make red blood cells, and nerve problems can develop. Numbers that reach 70 can cause mental retardation that cannot be reversed. And numbers reaching 130 or greater can cause seizures, death, and comas. So as you can see, this is a serious problem that we need to be aware of. Management involves preventing the child's exposure to the lead in the environment, treating the child for toxicity, monitoring blood lead levels, and correcting dietary deficiencies, if any, and removing lead from the environment through lead abatement. Children are exposed to the lead primarily in their housing by dust, chips from deteriorating paint on interior surfaces, exposure to lead-based paints during renovation, and lead leached into the water from lead pipes and solder. Exposure can occur with toys, candies, pottery, or home remedies that contain lead, cosmetics, dyes, insecticides, some dietary supplements, and ammunition, fishing weights, and some vinyls contain lead. It's estimated that in 2010, over 500,000 American children ages 1 to 5 had blood levels over the 5. The U.S. FDA has approved a rapid screening test that uses capillary blood and gives results in as little as 3 minutes, which can make testing very easy to identify any child at risk. In our community, Three Rivers District Health Department offers additional information and testing. The environmental health is ready and willing to reach out to families who are concerned. They recommend that all children under the age of 6 be screened for lead poisoning. Lead poisoning prevention is conducted among several departments within the health department. Children can also be screened at their primary care office. If levels are found, typically 15 micrograms per deciliter or more, education and further investigations are conducted by environmental health personnel in attempts to determine the cause through a risk factor analysis and sampling. Other elevated levels below 15, follow-up testing and education is provided. Depending on the levels found, the homeowner may be given recommendations or required to utilize a certified contractor to remove the lead. Kentucky Childhood Lead Poisoning Prevention Program is part of the Healthy Homes Initiative and offers a comprehensive approach to primary and secondary prevention of childhood and prenatal lead poisoning and other housing-related health hazards. In order to find out more about this health concern of our children, you can reach out to the Cabinet for Health and Family Services of Kentucky, the Centers for Disease Control, or our local Three Rivers District Health Department at 502-484-3412. Thank you, and I hope this has provided more information on lead to protect our children. Thank you.